Good day, everyone. Welcome to a next case, which I would like to discuss with you today from our series of new mitral valve repair techniques based on a single continuous stitch, which we have published 12 as a whole some 2 years ago. I'm delighted to see how the first of our techniques became so popular worldwide, the Roman arch. Today, however, I would like to introduce to you another technique, the so-called Minotaurus, which is named after a fable, a mythological monster of ancient Greece, whose head was that of a bull and the body of a human, a chimeric being. I gave it the name Minotaurus because it helps you remember the course of the single running stitch you have to do. Now, without much ado, I'm sharing my screen and let me go on full presentation mode. We all know how difficult and challenging it can be to repair valves which are characterized with Barlow's disease. Barlow's is like a chameleon. It can present in many phases. It's associated with excessive tissue formation, multiple jets, and often with mitral annular disjunction. Same goes for form frust or other forms of excessive leaflet tissue. Now, even the saline test may look good. In terms of Barlow's disease repair, you may end up with a very disappointing result. And it is stunning for me to see, both in case presentations as well as in live procedures, how great the variability of repair is among surgeons and how different the outcome. I will be introducing to you the Minotaur technique, which indeed will untie your hands. It will make your life much, much easier. It's a technique that we consider more reproducible, standardized, and you can carry it out with great intuitiveness. We are dealing with a 62-year-old Caucasian female patient of athletic figure who presented with symptomatic severe mitral valve regurgitation arising from Barlow's disease. She had a right-sided mastectomy and breast implant augmentation 15 years ago, but no irradiation. Here is the pre-op echocardiography. You see excessive tissue, both anterior and posterior, as well as a significant jet, central jet. Let me remind you, with help of an animation, the course of the Gore-Tex artificial cord stitch in the Minotaurus technique. It goes without saying that you can start on the right side, on the posterior commissure, rather than the anterior if you are right-handed, and you can conduct the Minotaurus in the anterior leaflet as well. You start from the commissures, down the papillary muscles, up the prolapses. You can take in P1, P2, P3, or respectively A1, A2, A3, and come out the other commissure. Put in your ring and tie after your satisfactory saline test. Let's move to the operation theater. Inspection of the valve reveals excessive tissue, both anterior and posterior, and multiple prolapses. I always start with the exposure of the annulus, which will bring the mitral valve to plane level so I can assess it and estimate the disease extent much better. So annular stitches first with 2O Etibond, ink test, so I can assess the length of the coaptation line as it is before the repair, so as to evaluate my buffer for repair and the size of the ring that I will be placing. In the interest of time, we're moving forward here. This may be on a light-hearted note the most difficult part of this procedure, which is go under the excessive tissue P3 from the commissure, from the posterior commissure, we're going to the papillary muscle, posterior papillary muscle, with both needles. We're exiting there and ascending to the prolapsing segments of the posterior leaflet, and then we travel across the margin of the posterior leaflet. Again, it's at your discretion whether you want to take P2 or P3, P2, P1 in one go. This has the advantage that you approximate potential clefts or indentations. Same with the second needle. It travels along the same path along the margin of the prolapsing posterior leaflet. In the interest of time, again, after finishing this course on the margin of the leaflet, we descend to the anterior papillary muscle, after which both needles of this single Gore-Tex suture will come out through the anterior commissure under P1. Remember, it's the commissure, not the trigon. This helps you control the disjunction of the mitral annulus at the same time. My choice of ring here was a CG Future ring by Medtronic. You see that if I feel, and that I do my first saline test before I fixate the ring, I adjust my Minotaurus arch. If I feel I undercorrected, I just need to pull on my stitches and the whole apparatus will travel down. If I feel that I overcorrected the posterior leaflet, I just pull on the leaflet itself and it's very forgiving. It will come up. When I'm more confident with my saline test, as you will appreciate here, I tie down the ring using cord knots and I tie down the Minotaurus Gore-Tex suture on the anterior commissure with a bit of air, maybe 1-2 millimeter. This way I allow the leaflets to dynamically adjust against each other. Closing the atrium, and let's see the post-operative result, which reveals trace or no residual mitral valve regurgitation. As a conclusion, mitral valve repair in Barlow's disease can be a daunting task and deceiving. The initial saline test result may deceive you, may look good initially, but the echocardiography result at the end of the procedure may be disappointing, forcing you to go back on clamp, on pump, and re-repair the valve. The Kofidis Minotaurus technique is fast, reproducible, intuitive, and robust. And remember, it uses less foreign material. You don't need to think. It eliminates the guesswork. No 10 sutures, no 12 or 15 Gore-Tex individual chords or multiple loops. You just follow an intuitive pattern. It can be part of a set of actions. You may choose to close a cleft elsewhere or insert an additional Minotaurus for the anterior leaflet. 2 Minotaurus stitches, therefore, can be performed at the same time, anterior and posterior. It's not an exclusive technique. That means that if you need to do something to address A3, you may as well do it. With that, I came to the end of my presentation of the Minotaurus technique. Please use it. I'm sure it's going to relieve you in cases of Barlow's disease or form frust, and I can't wait to hear your comments. Goodbye.